What's up? I'm Hutch, and you need to understand how to auscultate your patient's heart so that you can better take care of your cardiac rehab patients, and also pass the NPTE. Auscultating means that you're listening to the sounds of the heart using a stethoscope. There are 5 places on the anterior chest where it's important to listen. You can use the mnemonic All People Enjoy Time magazine to help you remember the points to listen to, what they're called, and what valve is associated with them. The aortic valve is auscultated in the second right intercostal space. The pulmonary valve is auscultated in the second left intercostal space. Erb's point is in the third left intercostal space. This point is the center of the heart, and it's easiest to hear S2 at this point. The tricuspid valve can be auscultated in the fourth left intercostal space. The mitral valve can be auscultated in the 5th left intercostal space, but more lateral than all these other points. All 4 of these first points are pretty close to the sternum, and this 5th point is going to be a little bit more lateral. When auscultating, you are listening for these sounds. S1, this is the lub of the lub-dub that you normally hear with a heart rate. At this point, the AV valves close and the ventricles contract. This is systole. S2 is the dub of lub-dub. This is when the semilunar valves close and the heart is in diastole, so the ventricles relax. S3 is a normal sound in children, but is called a ventricular gallop in adults. In people who have conditions like heart failure, there is increased pressure to get the blood through the heart. It's not functioning as well, and so the blood reverberates against the ventricular walls, causing this third sound. S4 is called an atrial gallop, and this is caused by stenosis, so narrowed vessels, or regurgitation at the valves, something abnormal like that to cause this extra 4th sound. S3 and S4 are heart murmurs. They're extra sounds that you don't normally hear in the heart. Regurgitation is when the valves don't close all the way, and so they don't prevent backflow like they should, so some of the blood flows back up, usually from the ventricles into the atrium. Now it's time for NPT Jeopardy! Pause the video now if you want time to read and think about the question. Otherwise, you've got 5, 4, 3, 2, 1. This is the lub of lub-dub and is a normal sound indicating systole. Hopefully that covers all of our bases. If not, you can always check out the link in the description box below to get a hold of some of my notes with sample questions, or you can drop a comment with questions or suggestions for videos to do in the future. Otherwise, good luck studying and go change the world.